very much, Mr. Speaker. Speaker, my question's to the Premier. Speaker, this government's record on health care has been disastrous. The Minister of Health has placed the system into a state of perpetual crisis. Last year alone in London, Windsor and the rest of southwestern Ontario, we've seen a cut to health care services and longer wait times. Due to this minister's freezing of hospital budgets, we've seen hospitals forced to cut staff or cut services in order to balance the budgets. St. Joseph's Hospitals in London has had a $17 million budget shortfall, which saw 60 nurses fired. Wow. Windsor cut 120 nursing jobs with a $20 million budget shortfall. All knee, hip and joint replacement surgeries were cancelled or postponed for January, February and March because of a lack of funds. The Premier has not answered the questions from the member from Nipissing or the members from Simcoe North. Does she have confidence in this minister, and will she replace him?
Minister of Health and Long-Term Care.
Well, Mr. Speaker, thanks. I appreciate the question. It gives me an opportunity, because it has been some time since I've been able to speak about the new investments in the 2016-2017 budget, $1 billion, so that our entire healthcare budget is roughly $52 billion. It's substantial, to say the least. But as part of that $1 billion, we're investing in a whole set of things. I've spoken, obviously, on the $345 million going to hospitals and the $12 billion going to the new capital investments. But I haven't had an opportunity to say things like $85 million of new dollars for that important area of recruitment and retention of nurses, of occupational therapists, of dietitians, many of them who are in the front line, who are working in our family health teams or other similar environments. Or, importantly, the work of my parliamentary assistant, the member from Ottawa Centre, I hope, South, an investment of $75 million to fund new hospice beds across the province, Mr. Speaker.
Supplementary.
Thank you, Mr. Speaker. Speaker, the only people that have confidence in this minister is the Premier herself. Just talk to the healthcare professionals across the province. They are disgusted with the access that they have had lack of due to this government, the public attacks this government has had on not only doctors but also pharmacists in this province. The Premier seems fine with this action. Mr. Speaker, we have seen the stem cell transplant system fail, resulting in deaths in this province, and the Premier is fine with this. We've seen this minister nurture a culture of fear in the home care system, and the Premier is fine with this. But the line was drawn a few months ago when Pete Verbeen, a 61-year-old Alzheimer patient, was forced to sleep on the floor in restraints for 8 days because the hospital was understaffed and over capacity. Even the member from London North Centre says this was absolutely unnecessary. Speaker, the healthcare system has been in perpetual crisis for years. There have been cuts in services, cuts in nurses, and our hospitals are over capacity.
Sorry, Minister.
Well, Mr. Speaker, obviously it's a big question, and I'll do my best to answer to the satisfaction of the member opposite. But, Mr. Speaker, we are investing so much money in new investments that are relevant to Ontarians, and I think Ontarians, at the end of the day, what they look to are the outcomes. Are they able to access a family doctor or a nurse practitioner? 94% of them are. In fact, just the year before last, the most recent figures show 900 more new physicians began practice in this province. That's roughly almost 4 times the rate of population growth. So we're making investments in our doctors. We're continuing to increase the line of for compensation for doctors. 3,000 more nurses practicing in our province last year alone, according to the Ontario College of Nurses. We're continuing to make those important investments in people, in property, in the facilities that people depend on across this province, Mr. Speaker.
Thank you.